We welcome you to our module, Pressure Ulcers, HCC 157 and 158, from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of pressure ulcers. At the end of this module, the learner will be able to describe pressure ulcers and their causes, identify the criteria by which pressure ulcers are diagnosed, note the different ICD-10 codes for pressure ulcers, review the assessment and plan for the disease. Pressure ulcers are also known as decubitus ulcers, or more commonly, bed sores. They are caused when the skin and underlying tissues are subjected to prolonged pressure. Pressure ulcers most often develop on skin that covers bony areas of the body, such as the heels, ankles, hips, and tailbone. Bed sores can affect anyone, but mostly, it affects people who spend a long time in one position. It could be due to paralysis, frailty, or aging. Constant pressure on any part of the body limits the flow of the blood to the tissues. Blood flow is essential to delivering oxygen and other nutrients to the tissues. Without these nutrients, the skin and nearby tissues are damaged and may eventually die. Other causes of pressure ulcers include friction and shear. The main criteria for documentation of pressure ulcer is a positive reflection in the physical examination. The documentation must always include the location of the ulcer on the body and the stage it is in. There are many conditions related to pressure ulcers with codes which we will discuss here. Documentation of wound or lesion alone is not sufficient to code them. Here's the list of ICD-10 codes related to the different stages of pressure ulcers. For pressure ulcer of left heel, when it is in stage 3, the code is L89.623, the HCC category being 158. For left heel, in stage 4, the code is L89.624, HCC 157. When the pressure ulcer occurs in the head and is unstageable, the code is L89.810, HCC 158. Similarly, when the pressure ulcer of the head can be classified as stage 3, it is coded as L89.813, with the HCC category being 158. And for stage 4, it is L89.814, HCC 157. For pressure ulcers of the other site, when it is unstageable, the code is written as L89.890, HCC 158. For stage 3, the code changes to L89.893, HCC 158. And when the condition is more serious, the code for stage 4 is L89.894, the category being HCC 157. Lastly, for pressure ulcer of unspecified site, in the third stage the code is L89.93, HCC 158. For fourth stage, it is L89.94, HCC 157. And when the stage is unstageable, the code is L89.95, HCC 158.
The assessment and plan should address the diagnosis and include 2 support indicators. The diagnosis must include causative agent. Use additional code to report infectious agent. Let's see an example of the progress note. Patient name: Isabella Simons. Date of service: June 16, 2019. Date of birth: December 30, 1994. Assessment and plan. Staph arthritis, right hand improving. Continue intravenous antibiotics as prescribed. Return to office in 2 weeks unless there is an issue with the intravenous site. Continue to rest the hand. Will refer to physical therapy when appropriate.
We've reached the end of our short refresher course on pressure ulcers. We discussed pressure ulcers, the areas of the body to which they are most susceptible, their causes, the list codes related to the diagnosis of pressure ulcers, and the treatment plan. Thank you for joining us.